TV. It's Thursday at 3:30. Thanks for joining us again. We have a great show for you. Before we start our show, we're going to go live in DC. Before we do that, I want to show some results from Orlando. I was in Orlando for the opening, and we just got a bunch of pictures from patients that got done in Orlando. So behind me here, we have a patient that we went live with in Orlando, and she had her back done. So we call this back bra roll. And you can see this is her 1 month. So that was a month ago that we went live. And that's her 1 month before and after, after. And she is beyond thrilled. She said it was a much better result than she could ever imagine. And she wanted to make sure we posted it because so many people commented when we went live. And I think a really important thing, besides the fact that, of course, she has like almost no fat in her back, is the skin tightening that Airscope provides. There's a lot of skin here. And here, it's pretty tight. So what I like to tell patients is, if you get Airscope, your skin will always be tighter than it was before. And that's what you see here, is much tighter skin. And now we're going to show it again. We did a woman's full legs. So her inner thigh, outer thigh, and banana roll and knees. And let's go look at her. Let me get away from her. So let's look at her. This is her before. Can we show some knee in there? Let's zoom out a little bit. Okay. So this is her before. What you can see is a lot of kind of cellulite, lumpy, bumpy skin, loose skin. You see saddlebags. You see inner thighs. Her legs aren't big, but she wanted them smaller. She was going on vacation, and they bothered her ever since she had children. And here is her 2 weeks later. She still has a little bit of bruising. I wanted everyone to see that. But you can see suddenly there's more space. Her outer thighs are much smaller. The contours are there. You can see a nice straight line. You can actually see the skin in 2 weeks has tightened considerably. But what's exciting is, now let's look at her 1 month. And oops, that's not her.
That's not her. Sorry.
So let's zoom into her 1 month, and we're going to post this, of course. But in the gray here, you can see here is her 1 month after, and what a change she has! It's incredible. She said her legs are the same as they were in her 20s. We have tight skin. No cellulite, no lumpy bumpy, smooth contours, huge change. She had about 1.5 liters removed from her legs, and she was already a pretty skinny woman. Can we see the back of her legs now? So let's look at her before from behind, and just zoom out a little so we can see to the knee. Okay, so zoom in as much as you can from the waist down. Okay. So there's a before, which many people would say is great, but that's her before. You know, we treat people of all sizes and shapes, and she's just wanted to look like she did in her 20s. She was actually a big-time model in her 20s and wanted to get her legs closer to that. So let's look at her 2 weeks, and we can see some shrinkage. You'll see a little bit of bruising. But what you can see is she wanted what people call thigh gap, and there we have the thigh gap. Her outer thighs are smaller, inner thighs are just no lumpy bumpy, just thin and straight. And now let's look at her 1 month. I think her 1 month is crazy good. I mean, here we have a couple of toothpicks. So let's zoom into that. Keep zooming. Okay, yeah, go ahead. So zoom in a little more. And yeah, I mean, this is beautiful work. It's incredible. So she has no outer thigh. It's a smooth contour. We have a dramatic change here. Her bruising is gone. Her incisions are almost completely gone. There's one that I can see right up there. Yeah, thank you. So, but for 1 month, I mean, for a 1 month result, this is incredible. And most of all, in 1 month to get this kind of skin tightening is extraordinary. So wanted to show that. Those are Orlando results. And now let's go live in DC, and we're going to talk about revision Aeroscope. So when someone's had another body contouring procedure done, they're not happy with it, and they come to us to have Aeroscope fix it. So we're going to go live with Raro in DC and learn about her case.
Hi.
Hi.
Hi, Dr. Rollins.
Hi. Thank you for letting us join your procedure here.
Yes.
We're in DC, and this is Dr. Moschetti, who's doing the procedure. We featured him before. And let's learn about Raro. So let's go in the OR.
Okay. All right, here we go. Let's go see Raro. All right.
Hello.
Oh, nice to meet you, Raro.
Nice to meet you as well.
How are you doing?
I'm doing really good. I'm actually quite comfortable. It legitimately feels like a massage. So I'm really comfortable. I'm excited.
Thank you. I'm so happy to hear that. Let me ask you the most important question of the day.
Okay.
What kind of music are you listening to?
So right now, I'm actually listening to some gospel music just to keep me cool, calm, and collective during the entire time.
Nice. Okay. Okay. So that's a really important question because you're wide awake.
Yeah.
And how much pain would you say you've had so far?
So right now, I honestly am not in any pain at all. It's been really, really comfortable. And so just honestly relax. The doctor is kind of walking me through everything that's happening. So it's allowing me to feel even more comfortable just because I know what's going on. And just everyone's so personable here. So it's really cool.
Thank you. And Dr. Moschetti, how many cc's have you gotten out of her tummy so far?
Out of her stomach, we're done with the front part, and we got about 1,500 cc's of really good fat. And she wasn't.
Okay,
I'm
we
sorry?
haven't done it yet. We have 1.5 liters out of her tummy,
Yes, yes.
but we haven't started her waist yet, huh?
Just the front part of her waist, and I was going to flip her over and finish up her waist. So about half of her waist is done.
If you want to put her on her side, you can do that, and I'll keep interviewing her. That's fine. Whatever works for you is,
Okay.
Operate.
We actually already had her on her side. She did finish her on her stomach.
Okay, perfect.
So we can do it. Put her on her stomach. If that works.
Whatever works for you is fine.
Okay. All right. Just have you roll over. Okay.
Alrighty.
While we Airscope Raro, we want to ask her some questions. So, Raro, tell me about your journey. I heard that you've actually had something done to your tummy before.
Yeah, so my journey has been actually quite a journey. So I've done a couple other procedures before. I was doing cool sculpting and maybe got into like 6 to 8 sessions, probably a little bit more. And so it really wasn't just giving me the ideal results that I really was looking for. And so I was able to research a lot about elite body sculpture and see this new innovative AirSculpt technique that is happening. And so once I saw that, I was sold, especially because it's minimally invasive. And I know that my results are going to be dramatic. I'm already going to be coming off the table, just really seeing this body that I've always wanted for my whole life, especially preparing for my wedding right now. I'm I have to be snatched.
Well, yes, you will be. So I think Dr. Moschetti's doing your waist right now.
Yes.
And as I've done many times before, I'm going to give you the most snatched waist you've ever had in your life.
I am so excited for it.
You're having AirSculpt right now.
Right now. And can you even imagine that I'm able to do a live right now? That's how comfortable it is to speaking, and it just feels like I'm in a nice little spa getting a good massage, so it's pretty cool.
Can we see her fat? Let's take a look at her fat bucket. Have you seen your fat yet? Let's see. What do we got there?
Let me get over here a little bit.
Wait, do we have
2 canisters.
Okay, so you've had 8 sessions of cool sculpting, and we've already got 2 buckets going?
Yes.
Whoa, okay. Hey, I have no comment on that, but that is good juicy fat. That's the real deal. You're going to have see, this is minimally invasive, but you're going to see it's maximally effective. You're already
Yeah.
skinnier. And we're going
I
to see
know.
the results.
I'm so excited to be
Yeah.
way skinnier. And I feel like the fact that I'm really targeting my problem areas where I have just struggled so much. I've tried everything and it just hasn't worked. And now I'm literally seeing the fat that I worked so hard to get rid of before but couldn't, just coming out in front of me. And I think it's so amazing.
It's crazy, right?
Yes.
I'm going to guess that you probably had some ledges and divots and some contour irregularities, and we are going to wipe those out. So,
yeah, listen, I am ready for this new Raro Lae 2.0 right now. So
we're
good.
going on your honeymoon.
So we're going to be going on my honeymoon next year, actually. So the ceremony is April 3rd, so we're going to be going on the honeymoon. But of course, prior to that, going on my bachelorette and everything like that. So I think one of the most important things to me was just to be confident and love how I look. And
I want you in a bikini is all I'm saying here.
Yes.
Okay. All right.
Yes.
As long as the bikini's involved, I know I can get you bikini ready.
Exactly, because I will be laying on a beach for sure.
Awesome. I love it. Now, a question we like to ask people while they're getting AirSculpt is, what would you tell someone who's thinking about getting AirSculpt? Would you recommend it? What would you tell them? You know, what do you think about that?
I would definitely advise for people to actually do AirSculpt. I tried so many procedures. Anyone who really knows like my entire journey, I tried everything under the book. And I think with AirSculpt, really you're getting the dramatic effects like literally right off of the table. I'm knowing that I'm already seeing like the type of figure that I would like to have, and I would really recommend it just because it's effective. You're getting those dramatic results that you're really yearning after, and then it's so comfortable having it. Like most people, you wouldn't think that it would be so comfortable. Like I'm literally able to talk to you right now. Yeah. And so I 100% would really recommend, like, this is the way to go.
I love this. And
yeah.
What you don't know is tomorrow you're going to be fine and be able to move on with your life.
Yeah.
No laying in bed. Tomorrow you got to walk at least 45 minutes and move on with whatever you would have done if you had not had AirSculpt, you can do except a heavy workout.
Right, exactly.
Yeah. You can eat what you want, blah, blah, blah. Okay.
Yeah.
So that's important, and I think you'll really like our compression garment, which you only have to wear for 2 weeks, not forever. And we made them really comfortable, so I'm excited to hear about that. And I can't wait to see your results, really.
Definitely. Neither can I, and I can't wait to share it with everyone.
Thank you so much, and thank you for sharing. It's a big deal to have someone let us in and all our followers watch your journey like this. And I really appreciate your bravery and your consideration here.
Thank you so much.
It's kind of you, and we really appreciate it. And let's make sure you get an AirSculpt hoodie.
Okay, definitely.
Thank you so much, Raro, and enjoy your procedure, and I can't wait to see your results.
Thank you so much. I can't wait to share them.
Great. Okay. Thanks, Dr. Machete.
Thank you.
Great job. Okay, so what we're going to do now is we're going to go and answer questions about having revisions using AirScope. So Lauren is going to read questions that our followers have asked us about what it's like to get other body contouring procedures you may have had done in the past fixed with AirScope. So go ahead.
What areas can I correct with AirSculpt?
So you can correct any area from the chin all the way down to the ankles with AirSculpt. Maybe you had Kybella on your chin and maybe you're not happy. Maybe you had liposuction on your chin in the 90s or the 80s and the fat grew back or it's lumpy bumpy, you're just not happy. We can fix it. If you can pinch it, we can take it. It's that simple. If it's irregular, if it's lumpy bumpy, we can smooth it out. One of the questions we get a lot is, sometimes people take out too much fat. And can we use AirScope to actually put fat back in? Fill in dents, divots, irregularities? And the answer to that question is absolutely. So we love doing that, and all of our fat transfers are no needle, no scalpel, no stitches. Of course, you're awake, but no syringe. So there's not even a syringe being used. We use our own AirSculpt system. And that's really important because we feel that the fat actually is more viable. It stays better, and we actually can predict what it's going to do once you're fully healed better. So it's really, really important. What are some more questions we've got?
How soon do I need to wait after my original procedure before getting AirScope revisions?
So we get this question a lot. You had a procedure done of any kind, invasive, non-invasive, whatever it is. You went to a different country maybe, you're not happy. We like people to wait 6 months because we need to know what you're working with, and hopefully in 6 months maybe you will be happy and then you won't need anything. But if you're not, once it's been 6 months, then we can AirScope you then.
Can you do revision AirSculpt on arms?
We can do revision AirSculpt on any area of the body. We do a lot of arms actually. A lot of people when they do arms, they don't go all the way up. They just do down here. And sometimes we actually did that in Orlando when we were opening the Orlando office a lot. So sometimes we have to go up further or more around the arm and not just one part. But yeah, we do arms every single day.
Why is AirSculpt better equipped at providing smooth, symmetrical, and non-lumpy results compared to traditional liposuction?
So probably the most important question we can answer is, why is AirSculpt so good at revision? And I'll tell you the answer is really, really simple. It's because AirSculpt is using a minimally invasive technology, that's elite body sculptures, and we're taking out each individual fat cell one by one. So we can be very, very specific. At the same time, because it's automated and it's moving so fast, we can kind of like airbrush you under your skin and smooth things out, kind of like a power buff, and make things more even and smooth. And it's really good when you have scar tissue from a previous procedure. Again, because it's automated and because the cannula is so small, we can get into places other people can't get into. And we can do it in such a way that we can break through the scar tissue and smooth things out, get rid of the lumps and bumps, and get rid of the contour irregularities. And that's really why. And of course, all while you're awake with no needle, scalpel, or stitches.
Someone asked how much fat can be removed in total.
Well, just like always, the answer depends on the state you're in, but it's typically about 5 liters. Some states is 4 liters, and we just follow the state law. But we can take out as much as you have to give us, as long as it's less than what the state requires.
Okay, I think that's about it.
Okay. Thank you, Lauren. Thanks, everyone, for watching. If there's any additional questions, please DM us. Is there anything right now, Lauren, that we've missed?
No.
Okay. Well, thank you so much for watching, and we're really proud to show these Orlando results. And thank you so much again for allowing us to see your procedure in DC, and we can't wait to see your results. So thank you for sharing with us. Bye-bye.